What to wear when in pain? Hi, it's Dr. Ruth, the Pain Doc, founder of Chronic Pain Rescue, a telehealth practice devoted to helping those who suffer from chronic pain using holistic and integrative approaches to become pain-free. It is possible. I was recently asked to give a talk about fashion for pain, and I actually prepared a little slideshow, but as it turned out, it wasn't that kind of a interview, and I didn't get to share my little bitty slide. So I decided, you know what, I'm going to go ahead and do that now. So what to wear when in pain? Is fashion something important? I'm sure some would say it's an expression of who you are, expression of your style, your personality. And just to say something that I learned in college, which was a long time ago, but I went to school on the East Coast, and I quickly learned that it was very important to know who you are. Because of where I was and the time in history that was, there were many people that had made judgment calls about me, made decisions about who they thought I was, not knowing who I was. And as I tell young people, it's so important to know who you are and to determine who you are, because otherwise other people will try to define you, and usually they will underestimate who you are. So that is just very, very important to know who you are, to identify yourself, and of course your fashion reflects that. Now, when talking about chronic pain, I've presented in the past, pain that has lasted at least 3 months, some people say 6 months, is defined as chronic pain. But there are other features. Chronic pain is not only about pain. Chronic pain syndrome has a host of problems or ailments with it. One being depression, another being stress. Many times people have issues with sleep. They're not able to sleep properly because of the stress, because of the pain. They can suffer from feeling a lack of motivation. You know, they're constantly being distracted by the sense of pain or the fear of pain, that they're not able to focus and concentrate on their normal activities or things that they have to do. Just makes things that much worse. They can have eating problems, either overeating, trying to maybe comfort themselves, or not being able to eat because the pain is so severe. So it can affect a lot of different areas of one's life. Now, the cognitive behavioral therapy process of therapy, it is considered the gold standard for treating chronic pain. And this is just showing the cognitive behavioral therapy triangle, where you have your cognition or thought at one corner, emotions and behaviors at the other two corners. And they all interact with one another. In fact, they all influence one another, so that, you know, you may have chronic pain and you can't directly affect that pain to say, oh, just make the pain go away. But you can have thoughts that can be changed that will affect your emotions, that can also affect your behavior and help to reduce your pain. Or you can have behavior that affects your emotions, that affects your thoughts, that help reduce the pain. So just like you can address, I don't think if you were to say, dress the way chronic pain makes you feel lousy. If you were going to do that, you would dress in maybe your house dress and slippers and never leave the house. That's not what I think you ought to do. But then again, you can dress to adapt. You know, if it's winter, it's cold, it's snowing, it makes sense that you're going to put on snow boots, you're going to put on a heavy coat, you're going to adapt to the weather. Or if it's a rainy weather, you're going to put on galoshes, you're going to use an umbrella, you're going to wear a raincoat so that you don't get wet. And so with that in mind, there are things that you can do, adaptive clothing that you can wear depending on where your pain is, what type of pain it is, so that it can help you and you can do better with those adaptations. For instance, for low back pain, You should not, if a woman, we're talking about women, no stilettos, heels. If you have low back pain, you should wear closed, flat shoes that provide arch support. Flip-flops are not a great thing for low back pain either. That's one thing. For abdominal pain, such as when people have Crohn's disease or endometriosis, you want to wear non-restrictive pants or skirts. Nothing that's going to press against your abdomen. For fibromyalgia or being hypersensitive to pain, you want to wear cotton, bamboo, or linen. These cloths are less irritating and hopefully will not aggravate one's pain. For joint swelling or pain, as well as low back pain, wear compression clothing such as Spanx to decrease your pain. That would help support your back. For pain with weight fluctuation, skin sensitivity, or bloating, you can wear maternity clothes, maternity pants with a belly band, and can provide low back support. And that's all for now. As I have said many times, if you are interested in working with a health coach for your chronic pain, to get out of your chronic pain, I'm here, I'm available. You can go to www.chronicpainrescue.com and reach out to contact us. We'll be starting a group program shortly, which I know is going to be off the chain. It's going to be very helpful to a lot of people, and would so love for you to join us. To have a group that you can work with, you're working on the same goals together, you go further. Anyway, until next time, peace and blessings.